So I am coming to you live here from Walnut Studios, about an hour north of New York City, right on the edge of the woods, where we're going to look at an integrated telemedicine platform built on the IBM automation stack. And it is another of the inspirational speakers that has made me so excited to do this session today. So Chase Palmer is CEO of Sunny Glen Children's Home, and Chase will explain to you what their mission is. And he's joined by Dr. Rosalinda Mercado, who also I find incredibly inspiring. And you know what? I'm going to get out of the way, let you explain how you're using these tools to achieve your goals. And then following you, we'll actually see what it looks like in action. So it's all you, Chase. Take it away.
All right. Thank you, David. And appreciate the opportunity to be with you all and to share our story at Sunny Glen Children's Home. It's been interesting to see all of the, conversation and things about automation and what it's doing for different industries. And we have been blessed to have the opportunity to utilize a platform known as iDirectDoc in a customized format to work in our shelters with the children that we serve in the foster system. And we're very excited about what that platform offers. And we'll share more details about that. But it's really about putting humanity back in healthcare. And, we have a comprehensive platform of case management that's now been integrated into the iDirect platform that has streamlined and made our staff more efficient and made our reconciliations as far as the impact of the life of that child being back with their family or continuing in our care the best that we can possibly provide. So to give you a little history and a little more introduction about Sunny Glen, I'm going to introduce Dr. Rosalinda Mercado. She's here with me. She's going to talk about her life and her experience with Sunny Glen Children's Home.
Good afternoon, everyone. Thank you so much for the opportunity to be here with you. I did want to give you a little bit of a timeline, and that is this. Back in 1990, the automation that you are talking about today did not exist. And because it did not exist, we, myself, as a child who lived here at Sunny Glen Children's Home in 1990, had to have different forms of doctor's visit. And I just want to follow up with what Chase said, that the very thing that I was looking for, which was care for my well-being, care for my health, which I knew at the time, even though I was 17, I knew that that was the thing that would propel me to move forward, was critical to my future success. And because I wanted to be a well-rounded individual, this telemedicine that's happening with Sunny Glen, to be able to fast forward it 30 years later, because this year would mark the 30th year since I placed myself in the children's home, and to see that they're still going above and beyond to meet the needs of the children, it just warms my heart, because right now you are seeing the technological aspects of all of this technology. However, there is a human being behind telemedicine, and there is a human being who needs these services. And with the recent changes with COVID-19, to know that sometimes you will have to be in isolation, but there is someone at the other end that is still vested and interested in your well-being. I tell you, I just applaud you for those continued efforts, and I'm grateful for this opportunity to allow us to continue with our mission and be able to do the work that we're doing virtually and be able to spread it amongst many, many more children, because the access will be there. So thank you so very much again for this opportunity to be here with you. I'm going to hand it back over to Chase, who's going to give you some more updates with regards as to how this system is actually working for our organization.
Thank you, Rosalinda. So as you can see on the slide, our mission at Sunny Glen Children's Home is to provide a loving environment for children who have had a history of trauma. And if you know anything about the foster system in any state, those children typically come into foster care from environments that have been highly chaotic and toxic at times, and where their not only physical health, but their mental health, their emotional health really has not been addressed in their home environment. So one of the things that we have to look at is a very holistic approach, that we treat the entire child. We're not just a hospital that's focused on their physical well-being. We're not just a counseling center that's going to provide the therapy, but we're providing all of those services in one place to treat the whole child. And that mission has been what we've been doing for over 83 years now. And to be in childcare, residential childcare for that long, helping over 7,800 children, we're very happy to be able to have that track record. But, as we've all learned in the last few months, things can change very quickly. And we have to have the ability to adapt. But I'm happy to say that we had a relationship with iDirectDoc previous to all of the COVID-19 concerns and the pandemic that struck our nation. We started this process back in November, actually October of last year, when our first telemedicine carts arrived on site. And it was like Christmas morning when we opened those carts up and began to see them and what the capabilities were that we were going to be able to utilize for our children. Here you see just kind of a snapshot of our history. And as you can imagine, any child that comes into care, you start building a case file. And we have comprehensive case management. We have counselors. We have a case manager assigned to every child. They have house parents. We have admission staff. We have clinical staff. We have education, dietary, shelter. So there's all of these different components and departments that work together to build this case file. And what we noticed was we had so many different systems that, dietary had one software solution that they were utilizing. The medical department had their own software solution they were using. Clinical and case management would use a different platform. And then we were having to merge all of these different systems at some point together to create a single case file for the child. You can imagine the miscommunication, the difficulty in the communication, the time that it would take to make that communication happen. And what we see with iDirectDoc is a solution to all of that potential inefficiency, because any of that inefficiency ultimately impacts the care that we provide to our child that's within our care at Sunny Glen. So we started out on a destination strategy, and this started back in 2010, and we kind of set the goal moving forward into 2030 to really see a production strategy where we look at our operational components of our organization that we wanted to excel, and then also to have this idea of an expansion strategy. And that expansion strategy definitely involves the technological advances and utilizing iDirectDoc that is powered by Watson Health and that artificial intelligence platform. So we started utilizing iDirectDoc, and what we noticed was it was that telehealth. And, most people, when they think of telehealth, all they think of is I get on my phone and then there's a doctor on the other line. And I can send the doctor pictures, or I can video chat with the doctor, and they can give me a diagnosis. They can give me a prescription. But what we've tried to communicate is what we've learned is iDirectDoc is so much more than just that. And as you're going to see in the demonstration that's going to come up following our presentation with Mr. Terry, you're going to see how comprehensive a platform iDirectDoc really is. And the thing that struck us as most valuable has been the customization capabilities. Terry and his team with IBM came in, and iDirectDoc came in and met with our team, and we war roomed it. We got the whiteboards out, we sat down, and we marked everything that if we were going to create something that would be unique to Sunny Glen, that would create the case management that we really need, this is what we would want. And Terry and his team have worked tirelessly to, along with our team, to be able to create that comprehensive case management platform. So just for you to kind of get an idea, in our shelter, we have over 40 clinicians who are our full-time therapists. We have 8 medical coordinators, 63 case managers, 25 in our education department, 400 plus direct care workers, and the potential for having up to 500 children. So having that volume of people in one facility needing to expedite communication, to maintain accurate case files, to have efficient information flowing through our system so every department has what they need to ultimately complete that case file for every child, it's a huge task. And since iDirectDoc is a role-based solution, every department can plug right in to their role. And it's not confusing. It's not overwhelming. Our medical department doesn't have to worry about the case management aspect of it. Our case managers don't have to get bogged down in the medical. Everyone role-based completes their portion of the case file, and then we have a whole completed case file for every child that we serve. So the other thing is that we have immediate point of injury support. So anytime that we have a child that gets injured, say in an activity, or, if they started showing signs of COVID, for instance, we're not having to then communicate with a doctor to get an appointment. We simply utilize the iDirectDoc platform and instantly can be connected to our PCPs who we have MOUs with that provide the care for our children through that platform. And the child never has to leave our shelter unless they're requiring more medical attention, that, they need to be hospitalized or something of that nature. The other aspect of that is this. Many children come into foster care without understanding a relationship with a doctor. They may have never seen a physician, or if they did, it wasn't very often, and they don't have the relationship with medical personnel that allows them to trust and be put at ease. And gaining trust with our children is one of the most challenging and really the most important thing that we have to do to be able to care for that child. So, just imagine yourself a child that's been taken from your home for whatever reason. You've come into this new home, a new shelter. You've met people who are telling you they're going to take care of you, they're going to help you. And then one of the first things they have to do is say, well, now we need to have a medical appointment. So then now we have to take that child somewhere else and go to a doctor's office and sit in a waiting room. And, then they're introduced in another new environment with new people, and it can be overwhelming. So what we're able to do is conduct those initial medical assessments at our shelter. So the child comes to us, and within 24 hours, they have an initial medical exam, but we don't have to transfer that child or take that child anywhere else. We can do that at our shelter through iDirectDoc and that platform. And it just gives us the ability to put the mind of that child at ease as they're getting to know those who are going to be taking care of them. And that, to me, on the side of humanity is what's really valuable. Because, I've seen children come into our care and come into our shelter who are just scared of anyone and anything. And what we've been able to see is that fear subside and transfer into trust. And we gain their trust, we work with them, and they know that we're going to do everything in our power to take care of whatever needs that they may have. And that, to me, is the ultimate value of iDirectDoc. It fits within our overall mission and our holistic approach of caring for the entire child. and provides us that comprehensive case management platform. So we look forward to continuing, utilizing this technology. We've already had conversations with Terry and his team about some other aspects that we think would be valuable to add to the platform. And we certainly are looking forward to the relationship that we have with iDirectDoc continuing into the next few years and decades to come, because this is our new reality. And, I keep hearing people say, well, we're going to get back to normal. Normal is not going to be anything like what it looked like before. And I think we need to recognize that and then leverage this technology to continue to support the mission of organizations like Sunny Glen and others who are doing our best to, like I said before, put the humanity back in healthcare. So again, we thank you for your time. We thank you for the opportunity to share our story and our experience with you with Sunny Glen Children's Home. David, thank you very much.
Well, let me thank you. You're doing amazing work. Thank you, Dr. Mercado, too, for sharing your experience with us and for the work you do. We talked about this event having plenty of heart and plenty of humor. Well, you have brought the heart, and I appreciate it very much. A great story about how automation can help you actually achieve your human goals. And now I bet the audience is quite anxious to actually see what does something like this look like. And so we will segue to Terry Cooper. You are CEO of Imperium Legacy Technology. I think you have wrangled a number of technologies, people, organizations together to mix AI, case management, telehealth, and to build this integrated solution. So there's some kind of very special talent that must be required to do what you pulled off. Why don't you share with us what it is that we've just heard about from Sunny Glen?
Thank you, David. Thank you, Chase and Rosalinda. I am very appreciative of having the opportunity to sit with you all this afternoon. iDirectDoc and Sunny Glen were kind of made to work together. Sunny Glen's mission, as Chase has carefully paraphrased, is placing humanity back in healthcare. That has been the ultimate goal of my development of iDirectDoc, the healthcare as a service platform. Now, it's also been mentioned by several speakers that this is more than just a video interaction. Our solution is designed to engage the patient and to deliver the value that's most important for the patient. And the relationship is the piece that's always been missing from my perspective. And now we've built a platform, I believe, that allows that relationship to grow and to be more of a lifestyle support for healthcare. And what I'll do, I'll walk you through kind of a high level of how we've done some of the integration. And I'll talk a little bit about Imperium Legacy Technology. We're an IBM business partner. We've made our baseline in being in this business about AI and being able to integrate machine learning, all for the benefit and support of humanity, replace in either jobs or otherwise, but to enhance the things that matter to patients. We developed our solution using almost the entirety of the automation platform, and then included some Watson Health features, as well as some Cloud Pak for data. And all of it's built around workflow and understanding how the connection between the doctor who chooses to be a better doctor and a patient who's really seeking that care when the care matters. Not in a 2-week time span. Once you call the doctor and they say they can schedule an appointment for you in 2 weeks, we can do that right now, anywhere, anytime. Our solution is both mobile, native, for iOS and Android, and we have the capability for you as a patient to ping your doctor or your care provider anywhere, anytime, and to do a video interaction right then and there, all while in your record. So any of the interaction is captured there. He doesn't have to leave, put you on hold to go enter something. It's all done while you're in that interaction. So what you're going to see here shortly is a demonstration of that, where we did a role play between myself and a colleague along the lines of doing a full role play. We can deliver also for rural environments and austere environments via our telemedicine kit. And this has the solution on it. This is a full-scale computer. And we have satellite capabilities to connect you in rural America and still deliver that same value that we think is important for healthcare. With that being said, I am going to move to the video of the demo.
The screen you see before you is the landing page for a doctor. And as you see to the left of the screen, you see that you have the ability to see your full schedule for just yourself, and or if you needed to see others that may be in your office or practice, you can also see their schedule here by unchecking this box. To your right, you see your workflow. And the My Work is specific to you, the doctor, and all assigned work is more of an administrative tool for you, the doctor, who manages the practice, can see what all types of activity are that's going on within your practice. Let's move to a patient record. And today we're going to be working with Rebecca Adler. I am going to open her record. And what you see before you is the profile of a patient when the doctor enters their record. To your left, you see the relationship-oriented data, date of birth, types of insurance. We have enhanced demographics, and this is more along the lines of what we consider relationship telemedicine. We want to know as much as we want to know about our patients because we believe relationships are just as valuable as any types of medications that can be prescribed to a patient. If we move down farther, we will see we have health plan alerts, and health plan alerts are designed to keep whoever is interacting with the patient fully aware of any types of urgent issues that may be going on with the patient. Maybe they're chronic diabetic, maybe they have high blood pressure, or some of the other maladies that are chronic. And lastly, you will see the care teams. Care team is designed to have you, the doctor, as well as any nurse or any specialist that's associated with this patient to always be accessible to both the patient and other members on the team for this patient. In the middle of the screen, you see all of the relevant data that's captured when you onboard a patient. You see the patient's name, SSN, if that's significant in your practice, their address, phone and email, any emergency contact, or other contacts or notes associated with this patient. And one of the significant pieces about the iDirectDoc solution is it's role-based and it is completely mobile, native mobile for iOS and Android. Here you have any insurance information for the patient. You have the comprehensive problem list of the patient. And this is significant, where you capture every interaction that you have with the patient via a doctor visit. That is captured here. And to your far right, you'll find any documents associated with this patient's record here. Now, what I would like to do is visit with one of our patients, Rebecca Adler, and to demonstrate the functionality associated with the video integration of our solution. What is significant is that we're a comprehensive telemedicine solution, more a healthcare as a service versus just a video functionality. So let me move to video. And I am going to start a call with our patient, Rebecca Adler. Good morning, Rebecca. How are you? I'm great. Thank you. Thank you for joining in with us. Now, what I'm going to do, Rebecca, is I'm going to do a screen share, and we're going to kind of walk through some of the things that you wanted to address when you were last in the office. And we'll go through the entire visit, and you can ask any questions as we move along. As I mentioned, we're going to start with your health and vitals. In your last visit, I think you're in on the 4th. It looks like your blood pressure was normal, 120/85, and you did that here in Alpharetta, and didn't show any additional allergies of any sort. And it didn't look like we were adding any additional medications. One of the significant pieces that we talked about is the ways in which we can provide you more care notes associated with your concerns with diabetes. And this kind of gives us a highlight of what we're trying to achieve. And we're going to focus on the prevention and screening to kind of stay ahead of the game. Let's go back and take a look at the image you sent to me the other day on your finger. Well, let's take a look at, just as observation, obviously it looks like some sort of infection, but let's get a little more clarity. Let's visit a visual recognition tool, and I've also captured it here. And let's see if we can get a sense of what that is. Okay, so there are two ways we look at it. As you can see with the first melanoma, it's about a 73% chance it is a melanoma, or it could simply be a mucus cyst, which we believe is somewhere within the 90 percentile of what that probably is. But I think the value add in you getting it to me so quickly, we can better address it now versus waiting 2 or 3 weeks from now. So the other option we wanted to talk about, the other issue we wanted to talk about, was the medication that you're taking. I think that's lisinopril. You were wanting to know what are some of the adverse effects of lisinopril. And let's take a look at what some of those might be. Some of the common ones that affect, about 11% of the people that take it are chest pains, some neurological issues, dizziness, and a cough. So are those similar to anything that you've been experiencing? Okay, so you were simply wanting to be cautious on the change of medication. Is that a fair assessment? Okay, very good. So as you very well know, Rebecca, the same things that we're looking at here, you can see all of this data in your login as a patient as well. So you can access the same things that we're looking at here. Anything that we added, as you noted, this image that you sent us is already in your record, so you can go back and look at it yourself. And what you'll find is, let's kind of go through a little more of what your concerns were here. Concerns. Is A1C is high. Although the visit is quick, I wanted you to be able to see exactly what I'm doing and entering in your record, because indeed the record belongs to you and you need to know everything that goes on with it. You can access this record at any time. And just as you're doing now, I believe you're dialing in from your mobile device. Okay, so we've chosen what the ICD-10 code is for this visit. And we're going to encourage you to take your insulin. And now, I did mention that we wanted to go back and talk about your blood glucose and the recent measurement. So what I'm going to do is place this visit on hold so we can go back and take a look at that. So I'm going to place that on hold. And what that does, just so you know, that now moves this visit to here. This is now, I have to come back in and complete that visit with you before we finish this call. So, but let's go in and access your health and vitals. And let's look at your blood sugar here. Looked like it was 85 then. Let's do this. Today's date, and we're going to do that here. So you did it at home here in Alpharetta. And let's see here. What would you say it was this morning? 6. Okay. And that was Lancet. Okay. So we're now going to add that because we didn't have that from our previous visit. So now we've added that. And let's go back into your visit. We're going to complete that. So we're here. And now that we've done that, we got a good analysis of what we're doing. We're going to complete that visit now. And what you'll note is with the completion of that visit, as I mentioned earlier, you're able to then go into your record after this call, and you will see that document residing here in all of your other records. And let's just confirm that for you. Those are your recent visits. As you can see, they're kept chronologically. Today is 6:08. This is a visit we just did. And as you see, we've captured everything that we discussed today within our visit on the SOAP note. And that's now available to you in your record via browser or mobile device. And you'll note that within the secure messaging, you can just send us a note, just like I'm going to send you. I'm going to send you a note today talking about diabetes check. And please continue to monitor. So I'm going to send you this note, and you can respond as you need to by sending us your readings, and we can just keep this message going for as long as we need to. And that's all within your record, within iDirectDoc, so there are no emails. So it's fully HIPAA compliant, so you have no concerns there. So that's great. So thank you for joining me on the call. And if you have no further questions, I hope you enjoy the rest of your day. And we'll see you next time we need to visit. Thanks, everyone. I hope that gave you a little more enlightenment on what our solution provides. And that's only a very high level. It's very intuitive, lots of cognitive abilities, and we'd welcome the opportunity to share it with you in a live demo.